I'm excited to not only be an organizer, but also a presenter today. And I hope that this information that Phil provided, as well as what I provide, provides a nice framework for thinking about access and our current challenges, as well as our long-term challenges. We recently, and we being folks at the Oregon Child Care Research Partnership and OSU, Oregon State University team, recently completed 2 studies that resulted in 3 reports for the Task Force on Access to Quality, Affordable Childcare. This task force has a charge of taking a close look at what's going on in the child care system and early learning, as well as school-age care system, and coming up with recommendations. I have to acknowledge that I'm one person of a team of folks who have made these studies possible, and these are OSU co-authors and colleagues. Also, big thanks to the folks at ODHS and ELD and the partners throughout the state. If you got information from me asking for recruitment, we were able to do some great qualitative interviewing that I'll be presenting on, and that wouldn't have been done without your help. And then also a thank you to their study advisory group, who were invaluable along the way in designing the study, telling us what makes sense, what doesn't, and all of that. So I'm going to present today in a little bit of a different way. Rather than talking about each study and summarizing, I'm going to organize some remarks around these key access aspects of childcare access. So access is complicated. We know it's multidimensional, and it relies on considering multiple facets and multiple issues at the same time. There's this wonderful definition that's provided a nice framework for folks throughout the states as well as nationally, and was created by experts, including our very own Bobby Weber was a part of this process. And this is the definition, and then I'm going to break it down and then talk about some key findings around each. So first, access to early care and education means that parents with reasonable effort and affordability can enroll their child in arrangements that support the child's development and meet parents' needs. So these 4 aspects. Reasonable effort is really focused on, does the care exist? Is it available? So I'll talk a little bit about the role of access in terms of what's been talked about recently as our childcare desert reality that is most Oregon communities, where there is simply not care to choose from. This is also looked at in terms of capacity and enrollment and other ways of measuring. Affordability should probably have a big A and an underline. This is a big challenge of the current child care system and a family's ability to provide care, and providers and educators' ability to provide that care and education for children and their families. These are things about how much it costs, the prices. There's a lot of discussion right now around the cost of care and how much it costs to provide care, and how the mismatch is with what parents can afford. Then that families wish that their child are in an arrangement that support the child's development. This gets to issues of quality. And we know that quality is a messy word. We know that quality at its base is does that child feel safe? Does the family feel good about sending our child here? It goes up to relationship quality, to those daily interactions, to the enrichment materials that are available. All these things are about stability, child development. And stability, like I was going to say, is also a key aspect of providing supports that are supportive. And then finally, does the care meet the parents' needs? Does it allow a parent to get to work? A big challenge we know, especially among all families, but particularly for low-wage families, is finding care that fits their work hours. Non-standard work hours are incredibly common, and fluctuating work schedules. And I'll highlight that too with COVID right now. And the parents we spoke to, a lot of them have really, their hours are ever changing. And so finding care that can be flexible and can meet those needs is particularly hard. This also includes things like transportation. So can the child, does the program provide transportation? If it's after school care, do they pick up and then take the child back to the facility or the home that the child's at? And so we know there are access barriers to all of these areas. And we also know they don't live alone. They're not, nothing is unrelated. So it's complicated. So these are the titles of the 3 reports that we did, the first 2 being around supply and demand. And if you're interested in these, I have the link up here, then we'll make sure the slides get posted. They're now highlighted on the early learners page. And so the first 2 studies are looking at supply and demand. To do this, we looked at community level access. So a year or so ago now, we, in the partnership at OSU, put together a report on childcare deserts. And in that report, we spoke to how Oregon is a desert, and then how counties are deserts. This report dives in deeper and talks about the community level, which we measured with the census tract. Other research uses census tracts, and we'll often refer to it as a neighborhood. That's another common way to think about it. Supply was the number of childcare slots in 2018. That's the latest clean data we have available. And for that piece, that's also at this community level. And so to get to that supply and demand, or what we call the percent access, again, we use access in a really sloppy way. So we're talking about how much care is available, how much care exists. We take that supply, how many slots there are in that given community, and look at that as a ratio to the child population. And in there, I put demand with quotations. So this is the potential demand. We know not every child and every family wants or is able or interested in having their child go to a facility that would end up in our count. Much of care is informal. And right now, as Phil demonstrated, a lot of it's happening in our own homes with parents and possibly grandma stepping in every once in a while. We also looked at how this community access varies. So looking at community characteristics, so the percent of population with each of these characteristics, looking at communities that were characterized by being low income, looking at 185% of the poverty line, a high percentage of single employed parents, children of color, as well as we looked at rurality. And then finally, public funding for this study was measured with contracted slots. So these are funds that are supported by Preschool Promise, Early Head Start, OPK, Migrant Head Start, and this is also as of 2018. So you can think about these data as a baseline of sorts, because we know things have changed. Then we also did a study on barriers to access. And for this, and a lot of the rest of today's presentation will focus on this, we conducted 30 in-depth semi-structured interviews with 16 providers, 12 parents, and 2 benefit eligibility workers that are in the field offices. And in this work, we strategically recruited to get a sense of experiences and of common themes across different types of providers. So really focusing to make sure we have a good number of home-based providers, centers, registered families, small and large home-based. Also parents with different ERDC experiences, and across Oregon regions. This was important from the beginning, and you'll see in some of our quotes, and if you check out the report, we have a lot of representation, well, not a lot, we have representation from Eastern Oregon as well as other rural communities, coastal communities, getting beyond the valley, the Willamette Valley, excuse me. Okay, so now I'm going to switch and dive in to these 4 dimensions of access. So as I mentioned, reasonable effort are things like like, is the care available? And these are some of the indicators that are often used. This also includes the information. So are parents able to get the information about the programs that they're interested in, and make an informed decision about the care that they elect for their child? What we see when we look at the community level is that 3 out of every 4 communities are childcare deserts. If you think about a childcare desert being, there's less than 1 slot for every 3 children. And communities really vary widely in how much supply exists. And when we look at how communities vary in terms of their characteristics, or low-income community compared to a community with fewer low-income families, we see that rural communities tend to have less supply and less access for children than urban, and lower income families or lower income communities with children from low income households also tend to have less in their nearby vicinity available. And we also know that that's of 2018, right? So things have continued to change. We know that there's a lot of challenge, and things continue to ebb and flow as we all navigate this messy reality that we're in. Through the interviews, these interviews were done in the summer. It's an important context. They happened in the summer months. And so at that point, there's a lot of concern about what's going to happen in the fall, and a lot of awareness of that the availability of care has declined. One Eastern Oregon parent or home-based provider explained that the way she saw it was that the conditions went from a Sahara desert to quicksand. That's the only analogy I can think of, because it was bad and now it's much worse. Parents in the interviews we did also talked about struggling to get information they needed to find the childcare. They were often overwhelmed by getting a list from the DHS office or otherwise and that came from the 211. And many of them found themselves using other avenues to identify the provider that they were going to be able to use, and it took a lot of time and effort. One provider remarked that parents rarely tell her that they got my name off the 211 listing. She states, "They'll tell me that they found me on a search on Google, and I've rarely been told that they found me on a listing." And this was a common remark, is that the information that was out there is hard to use. There was acknowledgement, and I think it's very important to say, I know many of you are here from CCR&Rs, that there was acknowledgement and appreciation for the efforts going on to update those vacancy rates all the time. There's 2 providers at least that talked about the appreciation that they know that how much work is going into that. But we also know the conditions and the vacancies and who has space and who doesn't can change by the day, by the hour. Parents also talked about the struggle of not only finding a provider, so somebody who can take care, but finding a provider that both has availability, they have an open slot, they have space, they can care for the child for those hours that are needed, as well as they also are willing and up for working with the ERDC program. And ERDC, I realize I did not define, is employment-related daycare, and I use that interchangeably with the subsidy system and when I talk. So apologies for that. One parent explains that using the childcare subsidies was a little bit harder to find a provider because they're limited options and because they can only take so many kids, okay? So providers talked about how they restrict how many families they serve, and that's largely because of financial reasons. When providers are asked about why they restrict so many numbers of children using ERDC, they explain that they wanted to serve more, and many of them felt worried that they were turning families away, but they saw themselves at risk for not getting paid. They talked about how it was hard to take on families that use ERDC because the copays were high. And so some people's copay, one urban small home-based provider explained, some people's copay is like $600. So if a parent doesn't pay you that copay, you're missing $600 from your check. And so there's a lot of nervousness and concern around taking ERDC, and a lot of providers restrict and say, okay, I'll take this many, my financials are such that I can take 10%, or I can take 2 ERDC slots. We then go into issues of affordability. So like I said, these are things about costs to parents, costs to providers, and public programming, and where public investment and investment plays into this. You may have seen before, the U.S. Department of Human Services recommends that childcare costs not exceed more than 7% of a family's income. And we know, particularly for low income households, that this is far from the reality. People are paying 30% or higher of their incomes. These costs to parents often constrain what is actually accessible to them. There's a lot of out-of-pocket expenses, it's particularly for using for low-income families using the subsidy program. Like we mentioned before, if there's a higher copay, there's still cost to parents, and there's also additional charges at times. And we also know that that childcare, even if we're not charging a price to parents, we're still there still needs to be money going into that, and so the role of public investment is also an important piece to keep into the conversation. So we know that public assistance, such as ERDC and subsidy, in particular helps, but the high copays are a significant challenge for parents to afford. One parent shares that, I remember feeling frustrated. I'm feeling like, I need the assistance, and not being able to obtain that. And then hearing how high my copay was going to be was really discouraging. And that was like, childcare is probably the biggest stressor when you don't have it. This person was declined. They were approved for the benefit, saw what their copay was going to be. They're at the higher end of the scale for eligibility, and decided it wasn't worth the effort. This parent has since reapplied with the COVID emergency programs, who show that, and she's not paying a copay at this point, and is pleased with being able to use the program, and is worried about when the copay returns, what she's going to be able to do, if she's going to be able to stay in the same care. We know that affordability is a barrier for all, but a very few number of families. This isn't an issue that solely is a low-income family, with quotes, issue, a poor poverty issue. Affordability is an issue for all, but a very, very few families. And parents recognize that, and providers recognize that. One rural parent who left the program due to COVID, she no longer needed to use it. She was working from home, and so decided to keep her children home, and talks about her and her partner both work full time, but we don't bring enough money home. We all need kids in childcare. It's a struggle for everyone, not just low income. And I really wish they would take that into consideration, and they being the state. Because I know a lot of families that they have a higher income, but they can't work because they have 3 kids. So we know within families, those decision-making happen, and is an important piece of the understanding of affordability for everyone. And providers spoke to this as well. They spoke to this tension that they navigate between being affordable and charging families what they know they can afford, and their own financial stability. So this mismatch between the tuition price and the costs of running their programs and making a living wage. And a lot of concern of that right now with COVID. One provider shared that they have only raised their monthly tuition by $25 over the last 10 years. Yet, I believe this is a certified family, so this is a large home provider who has staff, yet her staff wages have quadrupled. And so that leaves, that margin that she's been leaving is getting smaller and smaller to survive on. One provider shared that they used to charge above the DHS reimbursement rates, and they used to charge more. But now that they have a few contracted slots that they have set up with the state, they're able to reduce the parent tuition prices for other families. And then we talked to providers who spoke to that they will be increasing their tuition rates this coming year due to COVID. A lot are saying, told us I think I'm gonna have to up it in the fall or in the winter. I just don't see how I can keep my doors open otherwise. And people had different takes on how they were gonna deal with that in terms of the families that they're serving on ERDC or on the subsidy program. For example, having folks who can, they won't necessarily charge that copay to families that they know couldn't really afford it. So even then, although they're upping their rates, they're also thinking about what's fair to the families. And then finally, public funds really help parents and providers stay afloat during COVID. The most talked about beneficial emergency ERD policies that came up were the waived copay. It really helped, and there was talk around the benefits for financially and just and as well as the relationships between the parents and providers has improved because they're not having to go back and forth and complete billing forms and find out if they've paid their copay and these things that can really strain the provider-family relationship. Increased income eligibility has been helpful. One provider spoke to being able to stay afloat because some families that stopped using care and that were using the ERDC program were able to be replaced by some families that had higher incomes and that were able to get onto the program. And then finally, attendance policy around not taking attendance and allowing some flexibility there for providers to continue to bill and move on and still get paid. There was still a lot of caution and concern around when these policies were going to end. They were talking about this really feeling month to month. And if you think back to the summer, that was very much the case of, we don't really know. And as we were going through the study, even we found that the interviewers would say, oh, I just learned this, that the waived copays are extended to this point. And so there was a lot of discussion around how do we keep these going. And a lot of people want to keep a lot of these policies in place. That was very clear after the program, or after this all ends. The other aspect of access that's incredibly important is supporting child development. This is measured by things like our SPARK, Oregon SPARK, QRAS ratings, as well as other ways. So how coordinated the child care settings are with each other, as well as with other sectors. Practices that encourage stability for a family, keeping them with a single provider for a long period of time is better than bouncing around. And practices that meet children's unique needs, particularly those with higher behavioral needs and others were brought up. So on this note, parents reported in the interviews that they struggled to find a stable, quality provider. They found it hard to find somebody that they felt safe with and really talked about safety when they discussed quality. One Eastern Oregon parent explained that and was reluctant to say, but then said it was kind of a nightmare to search for childcare. There are some terrible places that this parent visited that I just wouldn't want my kids to go to. This parent then talked about bouncing around and having to go to different providers until finding one that worked and was able to serve this person's multiple children. And now this parent is very pleased and talks about their provider as that she treats them as grandchildren. They're treated more like family than they are as resources. And so that nurturance is very important to a lot of families that were talked about, that spoke about struggling to find, and then once they do find them, holding on tight to these providers. Parents really talked also about really struggling to find someone and the challenge of visiting different places. There was one parent that had an infant and talked about going on multiple bus rides to go visit places and having a hard time finding somewhere that she felt really good about leaving her child. We also know that providers, it's hard to struggle to meet the needs of some children. Some particular groups that were brought up are infants and toddlers. We know that the infants and toddlers we struggle as a state to have enough care for infants and toddlers. We also, and so providers spoke about sort of the reservations about caring for infants and the lower ratios, the increased liability and responsibility. Children with disabilities were also a group that was brought up. I'll say we didn't ask explicitly about these groups and a lot more work is definitely needed. But around children with disabilities, really struggling to meet the needs, asking to, or a child with high behavioral needs, a provider talks about needing to ask a child and that family to leave because she didn't feel like she could meet their needs and really feeling poorly about that. Finally, providers spoke to how the subsidy and how they view ERDC as something to foster quality and thinking about public support investment as an investment in children. One rural certified home-based provider says that child care assistance is about the betterment of kids. This is about making sure we have high quality education in the state of Oregon, and we're gonna make sure that the bottom 15 or 20% of families, that's of incomes, can afford the very best care because it only raises it a level for everyone else. So there is a lot of focus on seeing the subsidy program as well as other public investments as investing in our future, investing in our children. And then finally, we are at the point where I want to talk about meeting parents' needs. This is our final indicator of access. This is distinct from reasonable effort. This is thinking about what a parent needs. So a lot of about the type of program that they prefer to have their child in, whether it's a center, a home, the availability of transportation, and a big one that deserves a lot more look is programs' hours of operation. In particular, parents' non-standard working hours make finding childcare difficult. And as I mentioned with the COVID realities, the parents we spoke about losing their job for a little while, getting it back, getting some hours back. So these hours are ever changing and the timing of them can be largely outside of that traditional 9 to 5. Interestingly, all of the providers that we interviewed were currently not working with non-standard hours. They weren't doing evening, weekends, but many of them had in the past and agreed that it was very much needed. One rural parent talks about when we asked, why do you think other families aren't engaging? Why do you think that families struggle to get involved and use this program? They talked about, another thing is like if you qualify for ERDC, but your hours are not normal hours, it's gonna be hard to find a childcare provider that can cover those swing shifts. So there is awareness of non-standard work hours making things difficult. So to sum things up, we know that Oregon families and nationally, families face barriers to access. They can be thought about under these buckets. I find these useful descriptives, but we know that these things are also interrelated. And we know that the challenges are feeling more intense during COVID. And these policies that ease financial burden that are in place right now with the emergencies are helping, but there's also a lot of challenge. The emergency child care regulations are there to support health, but providers really acknowledge that it's really hard to make ends meet financially with the additional regulations that they are doing what they can. There's a lot of different ways to go in future directions. I could go on about this for a while. This is a small study, so we were very limited and really focused on getting across the Oregon picture. More needs to go into this. There's so much potential in these data in terms of us going back and looking at them more, as well as thinking about who do we need to talk to more, who in here, what subgroups are important to get the picture for. Then also how broadly are these experiences being experienced? And something like a statewide survey could be a really helpful way to get a sense of how the themes that emerged in the report maybe how widespread. Like I said, deeper investigation of issues and populations, thinking about these local level contexts. So I spent just a tiny bit of time talking about looking at the census tract level. There's a lot of exciting work going on around really understanding where families live and where care is located, and thinking about distances between those, thinking about how the outside of the communities you're around affect them. And so there's a lot that can be done here to help us make good policy decisions. A lot of work is needed, and this was touched on in the interviews, but so much more is needed around cultural competence and thinking about how you define quality. Our home-based providers in the study definitely spoke to this need of having their quality and having their safety and their jobs being appreciated, and not always feeling like that is understood and what they do is understood in the field. And then we need to acknowledge the role of racism at all levels of the system and see how it's operating and address that. And by digging deeper into experiences, both in terms of depth as well as breadth, can help us get there. So in conclusion, please check out these studies. I love questions. We're working on some one-pagers right now to try to disseminate and distill. As you could tell from my rapid talking, we have a lot that we covered in a very short amount of time. And so I'm very happy to answer any questions that are pressing right now.
Hi, Megan.
Hi.
My name is Nadia Lucci. How are you?
Good.
Thank you so much for your presentation. It was very helpful.
Yeah.
And also, I did message you, but I guess I should ask you. So, yes. And you just addressed it in your conclusion, but it would be super interesting to see. I'm not. I mean, you're not very clear on what the parents and the providers, you know, if they were English speaking only, if they were Spanish, Russian, you know, whatnot. But so that would be my first question. Were these monolingual English-speaking providers and parents? And
yes, that is thank you for asking that question. I did breeze through that, and I'm glad you brought it up because it deserves attention. Yes, so we had a very short time frame and resources, and so these are English-speaking providers. We had, and as we recruited, we were asked, are you doing this in Spanish? Are you doing this in other languages too? And for this report, we're not able to. But I will say concerns unique to linguistically diverse parents, providers were brought up by the providers and parents in here to say, like, you need to talk to other people to get a stronger to get that perspective. So it's needed.
Yeah, definitely. And it was really nice also to see, you know, one perspective, because, you know, I would guess the outcome that you would get from minorities represented in the surveys and studies, it would be much greater. I think, you know, if it's bad when you are able to navigate websites and resources in English, I would guess, an educated guess would be, it would be much harder if you don't speak the language. So yeah, no, yes. I really appreciate that clarification, so that we have that vision that it probably is much worse.
Yes, and I appreciate you bringing it up. And I think there's it needs to be done, and it's an urgent need. And it was brought up by the providers and parents and folks that helped with recruitment too. And so, yeah, I very much appreciate that.
And and the last question that I had is, within your survey, did anybody refer to have either a really good experience, bad experience, or medium experience with 211 while they were trying to find childcare, or they didn't know 211 existed, or I don't know, I'm just curious.
Yeah, and I'd be happy to follow up around 211. We do bring it up a little bit. It was brought up. It was mixed reviews, I would say, so that's why I'm cautious to go too deeply into that. There was concern about the list being very general, and providers kind of had a deeper understanding of why it's so hard to have current data about vacancies and about those kind of things, that those things are changing. So there were some critiques, and some providers, when we asked, how do people find you? 211 was brought up sometimes, but a lot of the time it was word of mouth. And friends and family, and even somebody talked about going on to Facebook and posting that they're looking for a provider. So I think there's a lot of strategies being used, and I'd be happy to look into 211 further and share.
Yeah, did anybody bring up the CCRNRs? I know that now, at least ours, it doesn't take care of that, but we do get from time to time calls from desperate parents. So.
Yes, yeah, a little bit. A lot of parents don't know who exactly they're talking to, and providers did too. There's some talk around CCRNR and recognition, but yeah, there's a little bit in there, and I'd be happy to follow up around the role of the CCRNR.
Thank you so much, Megan.
Thank you.
Time.
Hi,
okay.
Megan.
Yeah.
Hi, this is Denise. I'm at EC Cares in Eugene. So I just had a quick question around, were you able to find out about the experiences of parents who have children with disabilities in terms of accessing childcare? Thank
you so much for that question. That one goes along with the need for future research. It was brought up. We did not target children with disabilities providers, but it definitely emerged as an important step, an important piece that needs to be acknowledged. There was discussion around the special needs rate and providers being very appreciative of it, but also recognizing that it doesn't feel like enough to really provide the services and the quality support that they need for their children. So there was some mention of it by a few folks, but it's another area for future research.
All right, Thank you so much.
Thank you.